Hey, this is Anney.
And Samantha.
And welcome to Stuff I've Never Told You, a production of iHeartRadio. And today, just quick content warning, we're talking about being laid off, fired, and just how much that can hurt, and some of the more recent things in our health system here in the U.S., but nothing too in-depth. That being said, today is April 10th, 2025. And also, Samantha, I hope I'm not stepping on your toes on this one, because you have another topic on the docket that I think is related to this. But we will come back and talk about that more, because this is sort of an overview. This is a quick overview. All right. So April is Sexual Assault Prevention Month. And to celebrate it, the Department of Health and Human Services, or HHS, here in the United States, fired somewhere around 10,000 people on April 1st, including most of the folks who focused on preventing sexual assault and violence. Simultaneously, the person in charge of preventing domestic violence at the HHS was put on leave. As we have discussed in previous episodes, these issues are things that disproportionately impact women. And these programs, which were mandated by Congress, had bipartisan support. And these cuts have been devastating, confusing, and have really hamstrung programs that depend on federal funding to operate effectively. This is one of many waves of layoffs and firings that have swept the country, including in our health organizations like the CDC, or the Center for Disease Control and Prevention. Many who were fired have spoken out anonymously in fear of retaliation, and the estimates of how many people were fired range from 1/5 to 1/4 of the workforce, which is one of the biggest on record. Some have recounted getting an unceremonious email on a Saturday night telling them that they were fired. According to NPR, quote, "The division works on prevention strategies for sexual assault, childhood abuse, and gun violence, among other forms of violence. Research and programming staff in all of these areas got cut." Not only that, according to The Guardian, divisions like the, quote, "Women's Health and Fertility Branch of the Division of Reproductive Health," or the Violence Prevention Practice and Translation Branch in the Division of Violence Prevention, had been hit really hard. And the whole team at Pregnancy Risk Assessment Monitoring System, or PRAMS, was fired. The Office of Health Equity was dismantled. And just a reminder, of all high-income countries, the U.S. has the highest maternal mortality rate, and this also disproportionately impacts Black women. They also cut the Assisted Reproductive Technology Program, which is about helping people who want to have kids have kids. So was the CDC team. They were cut, that provided contraceptive guidelines for OBGYNs around the country that they would reference, and that were really helpful for things like if people were taking medication or something like that. The Intimate Partner Violence Prevention team was taken apart as well. Many who have been fired have reported that it feels very targeted and telling as to what is important to this administration and what is not. And many make clear that it was not just a job to them, it was something that they cared about, and that this is decades of work and experience being essentially erased. Like a lot of things we're seeing, the firings were both incredibly haphazard. Some reported being fired on the spot if their badge was, quote, "loose" in their office, and incredibly targeted based on what the person was working on. And on top of that, most who were fired had till the end of the day to pack their things and go, which is not good if they were handling anything biohazardous or shutting down a lab safely, or even telling anyone, like, here's how this needs to run safely. Very dangerous. Any research databases that featured a reference to sex or gender were taken down for a bit too, to replace those terms even in scientific research papers. At one point, agency sites referencing gender-based violence and racism were also taken down. On top of that, despite the fact that the CDC recently received $210 million from Congress for local grants over 5 years for their rape prevention and education program, that the staff that distributes the funds has been fired. So the money is sort of in limbo, not assured. Basically, no one knows how to access it. A lot of organizations tackling these issues have reported being in a holding pattern as well, because basically they can't access this money that they were promised. Some Democrats have pushed back, writing a letter to RFK Jr., who is incredibly the Secretary of Health. So far, Republicans have been quiet. As for Kennedy himself, he has said some of the firings were mistakes, and that was always the plan. So great plan. Love that.
We meant to mess up.
Yeah, it was all
it's in your head,
yes.
Obviously.
And some people have gotten like, whoopsie daisy, we didn't mean to fire you. You can come back. But what kind of like job security is that? Like,
right.
And yeah, okay, this is huge for a lot of reasons. Labs around the world send the CDC samples. If something new pops up that hospitals don't know what it is, they contact the CDC. Many of the fired employees are worried that people will die from these cuts. And just again, to reiterate, like that's so much experience and research is getting erased. But a lot of the people are leading protests, raising awareness, joining or starting organizations. The people who were fired, which, you know, it's sad that that's the situation we're in. But they're still fighting and they're still trying to get the message out there. But the CDC is based in Atlanta. So we saw a lot of this. And I have friends that work at the CDC, and it just has been devastating. And no one knew who was getting fired or when or why. So it's pretty, you can just see the harm of it. Like you can physically see the harm of it without even knowing all of this. That being said, you can see the recent interview we did with Evan, the bioethicist, about ways you can get information outside of, because I had to look something up on the CDC the other day and I was like, oh no, what if this isn't right? I don't know anymore.
Right. Well, there's definitely a lot of conversation about who all is being fired, how many people are being fired, why they're being fired. Is this actually helpful? And the fact that, diseases like measles are coming back and kids are dying, but no one seems to really mind the few that are dying.
Yeah. And then I did read the article, but I only read this one article. So I read kids were overdosing on vitamin A because it's supposed to help them not get measles. And I'm like, this is a mess. This is a mess.
What a horrible idea. I mean, vitamins, sure, to a certain degree, but there's a reason for doctors.
There is.
And doctors are also the ones who discovered like the helpfulness of vitamin A. So
yep.
Okay.
Yeah. So we're going to have to dig into this more. It's still, the fallout is ongoing and still confusing. And like I said, I know, Samantha, you had one of your topics coming up is related. Yeah. So we'll be talking about this. But in the meantime, listeners, let us know if you have any thoughts about this, if you were impacted by this. You can email us at hello@stuffI'mnevertoldyou.com. You can find us on Blue Sky at Mom Stuff Podcast or on Instagram and TikTok at Stuff I've Never Told You. We're also on YouTube. We have a TeePublic store and we have a book you can get wherever you get your books. Thanks as always to our super producer Christina, our executive producer Maya, and our contributor Joey.
Thank you.
And thanks to you for listening. Stuff I've Never Told You is a production of iHeartRadio. For more podcasts from iHeartRadio, you can check out the iHeartRadio app, Apple Podcasts, or wherever you listen to your favorite shows.